Today, we're diving into effective ways to relieve period pain that a good doctor should tell you. First up, let's talk about medication options. NSAIDs, like ibuprofen, are one of the best ways to reduce period pain. The trick is to start taking them 1 to 2 days before your period begins and continue through the first 2 to 3 days of bleeding. Take it together with paracetamol to enhance the effect. Ginger has been proven by research to have anti-inflammatory and anti-nausea properties that can help ease your discomfort for period pain. Dietary supplements like thiamine, pyridoxine, magnesium, fish oil, and vitamin E can also help. Plus, a low-fat vegetarian diet has been shown to alleviate symptoms. Next, hormonal therapies. Combined oral contraceptive pills, or COCP, are particularly effective. Using it normally can reduce period pain, but continuous is even more effective at reducing period pain. Continuous use means taking the pills every day without the typical break for a withdrawal bleed. Instead, you may have a withdrawal bleed every 3 cycles, or about 4 times a year, significantly lowering the number of painful episodes you experience. Now, if you prefer non-medication methods, there are plenty of options. Heat therapy is a fantastic choice. Use a microwavable wheat hot pack on your belly. It's been shown to be as effective as ibuprofen. Don't use a hot water bottle due to the danger of burns. Regular exercise can do wonders. It boosts blood flow, releases endorphins, and lowers stress, all of which help reduce period pain. TENS, or transcutaneous electrical nerve stimulation, uses electrical pulses to relieve pain. It's easy to use and quite effective. To manage and lessen menstrual pain, consider lowering risk factors like smoking and obesity. If you experience severe period pain, it might be caused by secondary dysmenorrhea linked to pelvic issues like endometriosis or infections. In such cases, it's crucial to see a doctor for proper diagnosis and treatment. So there you have it, multiple ways to manage period pain, both with and without medications. Remember, finding the right method for you might take some trial and error, so be patient with yourself. Thanks for watching, and don't forget to like, comment, and subscribe for more health tips.